Hello, everyone. This vlog is going to be a continuation from our previous vlogs about COVID. We're going to discuss COVID symptoms and focus more in depth about going back to school after a COVID outbreak. I'm going to explain and discuss the school's guidelines of what to do if another COVID outbreak happens. First, when the school finds out that anyone is sick with COVID, they are required to address the entire staff, the student body, as well as the parents. After that, the school will then reach out to the parents and let them know that they are required to come and pick up their sick child from the school premises. After staff has been notified, they will figure out a safe place for the child to stay and be isolated until the parents arrive to pick them up. Masks will be required for children aged 2 or above. At this time, they will document the date and the time, as well as the symptoms that the child is feeling and what actions they are taking. For example, if the child was given medicine or whatever process is happening. And they will also record the staff taking care of the child. When the parents arrive to the school, the parents and the staff will meet and discuss how the child is feeling, the situation so far, and what to do moving ahead. The school also provides parents some guidance about what to do and when the child is able to come back to school. That guidance just has a few short rules, so I'll go over them really quickly. First of all, it says that a doctor's note is not required for the student to go back to school. It also states as long as the student's symptoms improve, they don't feel sick anymore, don't have a running nose, and just feel generally fine, that means they're able to go back to school. And lastly, as long as staff is able to take care of their child, they are able to meet the child's health needs without risk of becoming sick, then the child is able to go back to school. If the parents feel staff are able to take care of their child easily, then they're able to come back to school. It's important to note that the school also has to inform the parents, and they did that at the beginning, as well as the health department if this sickness is at risk of being spread. Again, the school will have to inform the health department of this. And like I said, the school will inform the parents of the other children as well. You must also consider your child's environment, what they're around at school. For example, children with disabilities, children with high risk of becoming sick. You have to keep that in mind when your child is coming back to school because you want to keep your child protected and you want to keep the children around your child protected too. Now we're going to discuss the general symptoms and prevention tips from COVID and other illnesses as well. Some general symptoms could include headaches, a runny nose, muscle fatigue or cramps, tiredness, fever, or diarrhea. Next, we're going to describe a few tips on how to prevent getting sick. First, as it's always important, stay caught up to date with your vaccines, whether that be COVID or flu vaccines. If you are feeling a little bit of a runny nose or a little bit of a sore throat and you think it's nothing, it is important to still stay home. Again, if you are feeling a little sick, feeling a little unusual, get tested. You can test for COVID or a few other sicknesses. If you do test positive for COVID, you are required to inform your doctor. It's also important to wash your hands often throughout the day. And especially before and after you eat, if you're touching many surfaces, wash your hands. And remember to wash your hands from 20 to 30 seconds each time. If you are about to sneeze, please make sure to sneeze into your elbow, into your hand, or into a Kleenex. And it's always important to wash your hands after you sneeze as well. Again, you can wear a mask if you're feeling unwell. There's several different kinds of masks that you can use. Next, I'm going to go over some tips on how you can stay safe and stay healthy. It's important to make sure that all of your vaccines and immunizations are up to date and make sure you're not missing anything. If you start to notice you aren't feeling well, feeling nauseous, having diarrhea, it's important to recognize these symptoms immediately. Also, it's important to practice good hygiene. That means regularly washing your hands, brushing your teeth, and showering. You can also take a test if you start to notice you aren't feeling well. You can always take a test and figure out if you are sick or not. Also, make sure to wear a fitted mask, not a loose one. Make sure it's something that is tight to your face, especially if you are socializing with people who you are not sure if they're sick or not. It's important to keep yourself safe and wear that mask. Or if you notice someone seems sick, they're coughing or they're sneezing, you can always put that mask on. Also remember to keep a safe distance from people that are sick. Keep that 6 feet away. Again, if you notice they're coughing, sneezing, have a running nose, you can keep that 6 feet safe distance from them. Now just keep in mind that your health is of the utmost importance and you cannot protect yourself from every kind of illness. If you do get sick with COVID or another sickness such as the flu or cold, it's important to consider your safety and to also consider other people's safety as well. If you have any questions or if you're curious for more information, please go ahead and reach out to Alexander. Alexander is our public outreach specialist. Thank you all for watching and stay safe.